Hello and good evening to everyone. Welcome to today's webinar, which is called Unprotected, Current Challenges of the Social Protection System in Lebanon Amidst the Crisis. It's organized by the Center for Social Sciences Research and Action, short CeSSRA. My name is Miriam Younes, and I'm the Research and Projects Coordinator at CeSSRA, and I will be moderating this webinar. We have two speakers that you can see and that I will be introducing to you in a bit. This event is based on a quantitative survey that we conducted between July and August 2022 among 1,327 participants in 26 districts scattered in all 8 governorates of Lebanon. The aim of the survey was to examine the social protection mechanisms and effective healthcare systems and coverages in Lebanon amid an ongoing social and economic crisis hitting the country since the financial collapse of late 2019. The survey was developed and implemented by Raymond Nader, who is one of the speakers of today's event. Raymond is an assistant professor at the Business Administration Institute of the St. Joseph University of Beirut, where he lectures in statistics and quantitative data and analysis. He holds a PhD in statistics from St. Joseph University of Beirut and a PhD in business modeling from the University of Toulon, France. Our second speaker is Nizar Hariri, and he's the author of the narrative report that is based on the survey. And this report was just published last week by CeSSRA. Nizar Hariri is a senior economist, a research analyst, and policy advisor. His research themes focus on education and labor economics. So Nizar will present the report and the main findings that come out of the survey. And Raymond will present to us the methodology and the process of data collection that he has been doing. And after this, we will have time for discussions and questions. Thank you very much. So please, Nizar, go ahead.
Yeah. So thank you a lot, Miriam, and let me start by thanking CeSSRA and all your team actually for this great occasion. It's a great opportunity. As you said, this presentation is based on a survey that was conducted last year by my colleague Raymond, and it's really nice to have this opportunity to work on such a very representative sample. We're talking about 1,000 and almost 300 respondents. So Raymond will present actually the data collection methodology, the research design, and I will try to be very brief in presenting the objectives of the survey. Main objective was to analyze the impact of the multilayered Lebanese economic crisis on the social protection system in Lebanon, and to examine exactly the social protection mechanism and effective health care systems and coverage, especially on the predominant contributory schemes. I will let Raymond start by presenting the methodology and the research design.
Thank you, Nizar. Thank you, Miriam, also for your for the introduction, and thank you, CeSSRA, for this great opportunity. Because really we were able to sometimes to discover new findings, and also sometimes to be more sure about some assumptions that we take usually in the everything related to labor force in Lebanon. So as Miriam said, it is a quantitative research mainly. So when we say quantitative research, we should talk about the questionnaire. So our questionnaire, we developed a questionnaire of 56 questions, of which 6 are socio-demographic questions. Type of use questions: closed-ended questions, semi-open-ended questions, open-ended questions, and mainly also 5-point Likert scale questions. And this to minimize and increase to the maximum what we call social desirability. The questionnaire was divided into 5 components or dimensions. First, employment status, socio-economic status, social protection coverage, family and solidarity-based assistance, and at the end, socio-demographic questions. For the questionnaire, the average time taken to complete a questionnaire was between 12 and 15 minutes. The response rate is or was approximately 89%, and approximately 82% of the questions or from this questionnaire were fully completed. And of course, all the answers were completely anonymous and confidential. So after the questionnaire, Nizar, can we go to the next slide, please? So after the questionnaire, we will talk about the sampling methodology, because as Nizar said, this is a representative sample of the Lebanese population, and everything related to the population was based on the last results of the Central Administration of Statistics and ILO Labor Force Survey. So we used the quota method according to three main quotas. The first of all, governorates and districts, as also Miriam said. So we took all the districts in Lebanon. Second, it is the gender. So second quota was the gender. And third, the age brackets. And I repeat, everything was based on the last numbers published by ILO and Central Administration of Statistics, the famous labor force survey. At the beginning, we were planning to have a sample size of 1,000 respondents, because it is enough to ensure 95% confidence interval and an approximate 2% margin error according to Cohen approach. But as also Miriam and Nizar said, we were able to have more than 1,000. It was like 1,327. Nizar, can we move please to the next slide? So the data collection process, the data was collected between July and August 2022 with a team of 35 enumerators, 2 coordinators, and 1 field manager. And when we say between July and August 2022, we have this idea of maybe, so it took like 8 weeks, but in fact, it took like 2 weeks or 3 weeks. It was really a kind of record to have all this data collected in this short period. So the cities or villages were chosen randomly from the districts, respecting the geographical characteristic for each district, example, coast city, mountain cities or villages, etc. The data collection method used computer-assisted personal interviews with the interviewer or the enumerator, combining face-to-face data collection method with the use of tablets and mobile phones to record answers given during the interview. So here the idea was also to go faster and especially to go into more reliable data collection methods. So it was not a paper-based, it was directly tablet-based on, so in this case, we reduced, of course, the probability of having more errors by doing the data entry. This method ensures, as I said, better quality data by facilitating the recording of the data as well as the enumerator monitoring, because also we were able to monitor if those enumerators went and visited the village or the city that they should visit. So at the end, some last few points here. So the data analysis process, data cleansing and data analysis took place between the 1st and 3rd week of August 2022. A total of, as I said, 1,327 respondents were selected. So after the response rate, I said it was about 80 something. So we're selected representing an oversampling of 32.7%. The data collection achieved a gender balanced sample with 656 female respondents out of the total, which represents approximately 50%. The ratios for districts and age brackets were fully respected. And at the end, all the questions and answers for this data were gender mainstream.
Thank you, Raymond. So I will move now to the findings of this survey, the main findings. Of course, we cannot go through all of them, but we will select the most significant and the most important. Maybe just before starting to present the results, just remind everyone that even before the crisis, Lebanon was characterized by a very fragmented social protection system that usually exclude low-income persons, and which is usually based on contributory schemes. So the objective was to see how this the landscape of social protection has evolved during the crisis and following the crisis. So the first set of results is related to the impact of the crisis on the Lebanese population in general. And we find that some 62% of the respondents currently have a monthly income below 8 million lira, so equaling to less than $200 at that time. So we're talking about the time of writing of the paper. It was in November 2022. At that time, $1 was equal to 40,000 Lebanese lira. So we're talking here about 62% of the respondents. And I remind you what Raymond just presented. We're talking here about a sample that we consider as nationally representative. So we could say that 62% are having monthly income below $200 per month. So this group could be considered the low income or the lowest income group, and people for sure living under the poverty line. So the poverty line is something that we could discuss, of course. It's very difficult today to define what's the poverty line for Lebanon. But if we take as a benchmark or as a scale, the poverty line defined by the World Bank for middle income country, and especially for the upper middle income country, we could say that 62% are below the poverty line. Secondly, around 13% of the respondents lost their jobs after the crisis, and the job losses reached their peak in the first quarter of 2020. Thirdly, the extreme majority of the respondents declared that their socio-economic status has decreased since the beginning of the Lebanese crisis. So here we're talking, of course, about the subjective perceived socio-economic status as declared by the respondents themselves. And this concerned almost 80% of the respondents. So here I present the evolution of the job losses after 2019. And as you see, the peak was reached in the first quarter of 2020. We're talking here about 23.9% of those who lost their jobs. They lost it in this first quarter. And as you see, the trend is declining, but it doesn't mean that that less people are losing their job. It means that more and more people are losing their jobs, but less quickly than before. Secondly, if you see the integration of these persons into the job market, we can see that around 35% found a new job after the crisis, while 51.7% did not find any job after the crisis. And in addition, we have 12.6% of those who lost their jobs after the crisis, who either found a new job and then they lost it, accounting for 4.6% of the sample, or 8% who have switched several jobs since the start of the crisis. And regarding the perceived socioeconomic status by gender, as you can see here, if you look at the first column here, you can see that women in blue were experiencing a perceived declining socioeconomic status more than men. When you look at the first column, those for whom the socioeconomic status has declined significantly. So women were more likely to perceive that their social status has decreased after the crisis. Now, the second set of findings concerned the level of and rates of coverage for the Lebanese population. So we found that only 60.4% of the respondents are currently benefiting from at least one insurance plan, either through private insurance companies or various publicly mandated programs, which means that 39.6% of the population do not have any coverage at all and left completely unprotected. Secondly, the level of public coverage of the unemployed has significantly deteriorated following the 2019 crisis, from 42.2% before the crisis to 34.9% in 2022. And finally, more than half of the homemakers, 53%, who are almost exclusively women, and a third of the retired person, 35%, are currently not covered by any public insurance scheme. So as you see here, in blue, you have the population who are not covered at all, left completely uncovered, 39.6%. And if we take the covered population, the 60.4%, so among the covered population or the insured population, we have this distribution between publicly insured or privately insured. So as you can see, the privately insured represented 53.5%, which means that private insurance are the main provider of insurance and or coverage in Lebanon. The third set of results concern the private versus public health coverage. And as I said, the privately insured person represented 32.1% of the whole sample. So they represented, as I said, 53.5% of the insured population. But concerning the whole population, they represented almost the third of the population, 32.1% of the whole sample. And private insurance companies remain the major provider of health coverage in the country, followed by the NSSF. The majority of the respondents have been able to maintain the same health plans in time of crisis. So the structure of the level of coverage remained practically unchanged, yet the rates of coverage, so how much we are covered, have decreased significantly. Half of a privately insured person have shifted to health plans covered in lira or in dollars, thus accepting higher participation percentages or out-of-pocket expenses and lower effective coverage. Most of them, especially those who are covered in lira or those who are covered by a publicly mandated program such as the NSSF, are quasi-uncovered. Regarding the effective coverage offered by the NSSF and the state-run cooperatives, 1 out of 2 respondents did not use their services at all in the last year, and less than 20% of the respondents declared to be satisfied with the service received. Only 20% were satisfied. So going back to the structure of coverage levels before and following the crisis, you have in blue the level of coverage before the crisis, and in orange the current level of coverage, meaning in 2022. So as you can see, the structure remained practically unchanged. For example, we can say for privately, if you look at the first column, the privately insured person, it almost remained the same. It was 57.5% before the crisis. Now it's 57.6% after the crisis. For the civil servant teachers, the last column, and public sector employees, you have a level of coverage of 9.1% before the crisis, 9.4% after the crisis. So it's practically unchanged. Yet, as I said, the level of coverage remained stable, yet the rate of coverage has drastically changed, and we will go back to this in the conclusion. A final set of findings concerns the family-based solidarity and gender gaps in social protection. So 1 out of 2 persons declared not receiving any kind of assistance from their families. 31.7% declared having high reliance on their family support, while 13.8% declared that the family is somehow needed to provide financial and in-kind support. Yet, regarding family-based solidarity, this is where we find the most important gender differences, because women are significantly more dependent than men on family support, 55% of women compared to 35% for men. They receive more in-kind assistance than men, while the cash transfers, especially those coming from abroad, seem to be more benefiting men than women. Women also are living in higher precarious condition than men despite the similar levels of coverage. They have significantly lower level of savings than men and less assets to use in case of medical emergency or to face uncertainties. And finally, more than 1 woman out of 3 declared not having any saving at all, compared to 28.7% for men. So finally, if we look at savings and properties per gender, on the first column, you can see that women in blue, the proportion of women not having any saving at all is significantly higher than the proportion of men having no savings at all, 37%, 37.5% for women compared to 28.7% for men. Similarly, for savings in bank account, the percentage of women having bank account savings is significantly lower than the men's rate. And for property, real estate, it's the same. For cash money, it's the same. Yet, one significant difference, women have more savings in terms of gold than men. In conclusion, so this first table will explain actually the level of coverage per type of insurance plan. As we said, the proportion of the Lebanese population not having any coverage at all is 39.6%. 16.9% depend on the National Social Security Fund. 6% on military and security forces, 5.4% on civil servant, teachers, public sector employee. 32.1% have a private insurance scheme. Yet, among this population, the privately insured person, 11% subscribed in Lebanese lira, and we could be considered as quasi-unprotected. 5.1% have their subscription in dollar, and only 16% of the whole population has a subscription in fresh US dollar and could be considered as almost covered or almost fully covered. The second conclusion concerns the winners and the losers. The private insurance companies remain the main provider of healthcare coverage, covering 32.1% of the whole sample, followed by the NSSF and the state-run cooperatives. Half of the privately insured population is currently subscribing to an insurance plan in lira or in dollar, meaning that they are only partially covered, while the percentage of Lebanese population who might be benefiting from an almost full coverage does not exceed 16% of the overall population. And finally, the relatively unchanged level of coverage and the increased premiums of private insurance companies indicate that private insurers are currently increasing their profit margin, thus signaling a transfer of welfare from the insured patients to the privately insured companies and the transfer of well-being from the lira insured persons to the dollar insured persons. So to go deeper in this final conclusion, historically, the Lebanese social protection system was skewed towards civil servants, public sector workers, and military and security forces. Yet it's currently excluding these former privileged groups from almost all its protection due to the dollarization of the medical bill when the official price grid is still denominated in lira. So the biggest losers in this current landscape are firstly homemakers. And to remind you that the proportion of homemakers covered by the National Security Fund has decreased from 26.1% to 19.8%. Secondly, the retired persons, the proportion of retired persons covered by the NSSF has decreased from 16% to 14.8%. Unemployed person, the proportion of unemployed person covered by a publicly mandated program has decreased also from 42.2% to 34.9%. The publicly insured person, representing 28.3% from the whole population. The persons with disabilities, who represented 10.1% from the whole population, and the privately insured person who subscribed in lira or in dollar, 16.1% of the sample. Thank you.
Thank you very much, Nizar and Raymond. I think, like, for me, what is what I think was very interesting about the survey and the report is that on the one hand it shows, as you said, like the fragmentation and the exclusion of the social protection, social security system in Lebanon, since that has been there since a very long time, and then how within the crisis kind of, I mean, we have a decline of everything that was already flawed, but still kind of protected a certain segment of the population. So those are also no longer protected. So I think what you said, Nizar, about the quasi unprotected, I think this is something that became very much real. So even if you see, you know, someone is registered at the NSSF or one of the cooperatives, this still does not mean at any rate that this person is covered or protected in any sense. And I think also what is really important, and I think what is sometimes dismissed in many discussions, is the rise of public insurances and how much they, I think they should be actually called the biggest winners in like a last slide maybe, because I think this is it's really significant that such a high number of people need a private insurance, even if they prefer, or if they have to pay it in dollars or in Lebanese lira, which like significantly decreases the coverage. But still, I mean, it's still better, as it seems, than any of the public coverage. And I think what makes it always hard to discuss these matters is, of course, that it's not a historical topic. I mean, we're still in the midst of the crisis, and I think while like the whole process of doing the survey and writing the report and now the webinar, there has been a lot of things getting worse. So in that sense, I think it is always very difficult, and it hasn't been, you know, there hasn't been any kind of perspective where these matters, they probably all have become worse if we do the same survey now. So we have approximately half an hour for questions. I have some questions, but I would prefer to give the first questions to those that are with us here. First of all, I mean, you can share the questions, you can write them in the chat or in the Q&A box. I can see them and I will just read them, and then Nizar and Raymond will answer. There has been one question just that the report is published, and we shared it in the chat, the link in Arabic and in English, so you can access it, it's open access. There has been one raised hand by Zahra Salah. I will allow you to talk, and then you can just address your question to the speakers. Okay, I don't know if she just, we'll see if the question comes up. Are there any other questions from the participants, from the attendees here that would like to ask a question? Okay, there's Saad Abdurrahman. I will just allow you to talk.
يعطيكم العافية جميعاً. سعاد عبد الرحمن، مديرة العلاقات العامة بجمعية المرأة الخيرية ومنسقة ائتلاف الحوكمة والحقوق للطفل مع Save the Children في لبنان، وعضو بمنتدى المؤسسات العاملة بالوسط الفلسطيني في لبنان. سؤالي بعد إعداد هذا التقرير، شو بالنسبة للوضع الفلسطيني داخل المخيمات الفلسطينية تزامناً مع إعداد هذا التقرير، علماً بأنه المخيمات الفلسطينية هي بتعاني الأمرين قبل الأزمة الاقتصادية بلبنان، فكيف بعد الأزمة؟ فشو بالنسبة لوضع المخيمات الفلسطينية في ظل هاي الأزمة، وكيف ممكن إنه يعني هي ما دخلت بالتقرير، دخل لبنان، ولكن المخيمات الفلسطينية ما انحكى عنها، علما أنه في أكثر من 200,000 فلسطيني بعيش بالمخيمات الفلسطينية. بس هذا سؤالي، يعطيكم ألف عافية.
Okay, maybe Nizar, you want to answer to this?
شكرا أستاذة سعاد على سؤالك. بالفعل سؤالك أكيد كتير محق. للأسف السيرفي اللي عم نحكي عنها اليوم ما أخذت ضمن العينة أشخاص من جنسية غير الجنسية اللبنانية. أولا لأسباب منهجية، لأنه الهدف كان دراسة تغير مستويات التغطية، والاشخاص اللي غير لبنانيين اجمالا يعني ما فينا نخلهم بهاي العينه، لانه لا يقارنوا مع باقي الاشخاص. نعرف نحن مثلا الوضع العاملين الفلسطينيين بلبنان بيساهموا يمكن بالضمان، مش كلهم اكيد، بس بيساهموا بالضمان، بيدفعوا اشتراكات، بس كما بيستفيدوا. فالهدف الاساسي من البحث كان هو دراسه تغير مستويات التغطيه والحمايه للأشخاص حاملين الجنسية اللبنانية. لذلك لم نأخذ بعين الاعتبار لا الفلسطينيين المقيمين بلبنان ولا السوريين ولا الأشخاص اللي هن من جنسيات أخرى. فأكيد سؤالك كتير محق، لكن للأسف هاي الاستمارة ما يعني أو هاي البحث ما بيسمح لنا نعطي أي results عن هذا الموضوع.
Okay, thank you, Nizar. I will switch to English because some people don't understand the Arabic. So I will also, because there has been the question from Emilia, and what was the question? The question was about what about Palestinian refugees in Lebanon? Because like did the survey or the report take them into account as non-Lebanese? And Nizar answered that in this survey and in this report, we only talked about Lebanese nationals, which was mainly due to methodological considerations, and also because we focused a lot on the contributory system as the NSSF that is in practice, I mean, it's a bit complicated to say, but in practice, it's only open to Lebanese nationals. And I think this is maybe also to answer to you, Saad, this is exactly one of the problems, of course, also of the Lebanese social protection system, that it excludes, it excludes many segments of the population, and among them, kind of any foreigners. I mean, there's, and this includes Palestinian refugees that are living and working in Lebanon, and they have no access to or hardly any access to social security, at least, let's say. We've been publishing an infographic about this. So maybe that's also open access, that is about how the social protection system in Lebanon excludes Palestinian refugees. And I think it is very interesting to look at how those those people, those like even other migrants, refugees, how do they deal currently with these non-existing social protection mechanisms in Lebanon, but it hasn't been part of this survey and of this report. Let me just check if there are anyone. I think Zahra said that she wants to try again. So let me just try again to if we can hear her question now. Okay, I don't know. It doesn't seem to work. But we still have some time. Maybe she will still come back with the question. You can also just type it, Zahra. Maybe it's easier to just type it, and then we can read it, and the speakers can answer. Are there any other questions from the attendees? Anything that was not clear that you want to address? Okay, maybe a bit later. I have actually, I mean, one question to Nizar and one question to Raymond. I will start with Raymond because Nizar already had a question. And I was wondering from your side, because I mean, when you presented it, it sounded like it all went really, really smooth, but were there any challenges in data collection and also analysis, that you would like to share? Because to be honest, for me, like quantitative research is something that I'm not really an expert of, and I think most people are not. So it's actually, I think it's kind of interesting to know also a bit about the challenges and maybe also limitations that you found out after while you did the survey.
Thank you, Miriam, for the question. So the idea, yes, of course, when we want to present, we present the bright side of the story. But the idea is our team is really very well prepared because they do a lot of surveys during the year. But in fact, for this survey, the main challenge was it was, if you remember, in so the last year, it's like today also, but those prices increasing in the if you want the fuel and everything related to the fuel. Okay, so this was the main, honestly, the main challenge. But technically and methodologically, the challenge was that yes, in some and of course it's something very Lebanese and very common to the Lebanese context. In some region, it was really difficult to do the data collection. Okay, so I'm talking about the regions from let's say, especially okay, we can I will say it so, especially in some region where there is some own security some own security, you know, not other than the army or the Lebanese forces, so not Lebanese forces, so the Lebanese official forces. So the idea, yes. So we had some problems in the North Bekaa, let's say, and we had also some problems in the district of Akkar, eventually, and of course some other problems in the south, where after the litany, you know the story, you have to pass, you have to check what we are doing, etc. So yes, those were mainly the problems in those regions, mostly the rural regions, if you want. But other thing, other than that, I think nothing mainly to mention, honestly.
Thank you, Raymond. We have two more questions. The first is by someone, did not say the name. How can we use, I think this is probably to Nizar, but maybe to all of us a bit, also Raymond. How can we use this data and evidence-based research to advance a more inclusive social policy making and reform in the country? So that's it's a difficult question, but maybe you have some ideas. And then we have a question by Alexandra, and I will let her speak in a bit. Or maybe let's take the question now, and then you can answer both of them. So just a second.
Hi, can you hear me well? Yes, thank you. Just a quick intervention and a question. Thank you so much for the survey. And I think the fact that it's representative is very important and gives us an update on the situation of social protection. A question related to the survey is, are you planning to do multiple waves of this? Because I feel that unfortunately, we're on a downward trajectory, and we would need to see, like in 6 months' time, what's the situation. So that's more like a request if this is not in the planning already. And second of all, you did mention access to exactly quasi insurance through NSSF and pension and stuff, and the pension and healthcare aspects of NSSF and other government funds. So I was wondering, could you a bit elaborate on whether people are still able to use it at all? The percentage who mentioned they are covered by NSSF, because we've been hearing that hospitals no longer accept NSSF, just take privately insured or fresh dollared patients. Same for the pension scheme. No longer know whether the NSSF or the civil servant pension scheme, is it paying off anything? What's happening? Is it quasi or just no coverage at all? Thank you.
Okay, Nizar, you want to answer maybe to both questions?
Yeah.
I can also say something then, but yeah, maybe just start.
Yeah, I think the question regarding how to move forward is also a question for you, Miriam. Regarding, I'll start by the second question and then go back to this. Regarding if we are planning to have multiple waves, we should have had this design from the beginning. We did not plan on having the same, but maybe Raymond could answer it better from this point perspective. Of course, it's always possible to have a second survey next year, for example, but I think it will not be with the same sample. Because it was not planned as such, I mean, but maybe Raymond could give more details regarding this. But for sure, one of the biggest frustration for us when we work in Lebanon, especially when we work with quantitative methods, our data is very quickly obsolete. So if you look today at the report, even though it was written by the end 2022, 3 months ago, it's already obsolete. The price grids are not the same. The exchange rate has more than doubled. For sure, the usage and the usage of the publicly mandated programs have significantly changed. So in our sample, for example, most of the people who were covered by publicly mandated schemes are not using this coverage, even though they are covered. Of course, why we need more analysis, and we need maybe more qualitative methods, and we need more discussions, and we need to have a better inquiry in some in the micro social perspective of those people. So now I might talk about other work that we're doing. For example, we're currently having a research with people who are working in the port of Beirut, and these people are telling us to not talking about different types of research or different design, but in quantitative research you cannot have the reasons behind or the intentions behind, but in qualitative methods, people are telling us, I don't want to go there, either because I'm frustrated and I don't want to be confronted by the situation that I will have to pay a service or a taxi to go and to get reimbursed peanuts. I don't want this. It's insulting for me. So there's different schemes, of course, different stories. We cannot generalize. But even if we are sometimes covered, we don't want to use this coverage. This is kind of stories that we are hearing today. How to move forward from here? I think Raymond started by saying something very interesting, that somehow when you do some kind of surveys and quantitative methods, at least you have something to back up your intuitions and to back up some of the hypotheses that we already have. Maybe it's something that we already knew before, but now we have evidence to support our actions. So this is already a beginning. Secondly, how to move forward to fight this kind of fragmentation. I don't know, but I'm pretty sure that the results of the survey are very, very alarming. We already know that what's happening in Lebanon, it's really undermining the universality, or what remained from this universality of the social protection system. Now the alarming or the scary indicators that we draw from this survey are in front of us, and we need to think about them all together. So I don't know, Miriam, maybe you might have another perspective on this.
Yes, no, I will say something about this, but I want to give Raymond a chance first to answer, and then I get back to you. Also, Alexandra, with what you wrote, but I will just give Raymond the first.
Thank you. Just I want to start from the last thing that Nader stated. I don't know if I can share my screen, but there's a question that we put in the. Okay, this is the question, Nizar. So the degree of trust and satisfaction with NSSF or cooperatives. So it was one of our questions in the survey. So you can imagine that only from the respondents, so only we have 20% that they are satisfied. 20%, so we can 80% that they are not satisfied, between neutral, dissatisfied, and totally dissatisfied. So this is if you want a quantitative answer about what Nizar was saying now about the trust and about going to get some peanuts from the NSSF or the cooperative, etc. So really the people here are not interested in having that, and they consider that even as if they are without any protection. So this is first. Second, about the question, if you are going to do this as a time series, so to repeat the survey every 6 months or every 12 months, etc. So yeah, first of all, it's not it was not designed as a panel at the beginning. So the 1,327 respondents, we don't have their if you want the information or everything related to them in order to call them again or to go to do the same survey after 6 months or 12 months. So we cannot have the panel, that's true. But of course, what's also true that we can take the same sampling techniques, going to the same villages, taking the same age brackets, taking the same gender proportion, etc. And we can, of course, monitor that. And it will be very important and interesting to set up this kind of time series to check for our main or key questions, how things are, unfortunately, will decrease or hopefully will increase, okay? So this is mainly my answers till now. Thank you, Miriam.
Yes, thank you very much, Nizar and Raymond. I agree, I think, with what you said, and I also think, especially with this, since everything changes so quickly and deteriorates, unfortunately, so quickly, I think it is worth to maybe do something similar soon and to see. But the numbers in itself, as Nizar said, are very alarming. For me, I always think the question of how this can be translated into policy making. I mean, this is always, I think it is always a very important question. And I think two things I think are important here. I think, I mean, from my experience, policymakers are usually, even if intentions can be good among some, maybe globally, they usually don't have so much time. So numbers can be quite convincing, I think. So it's always good to have numbers, as Nizar also said, next to maybe qualitative research. So I think this is really, therefore, I think this is something very important to have the numbers, but also to have the analysis to it, because when you first see the numbers, many questions for people other than Raymond, we did not really understand them at first. So it really needed some time to really understand what does this actually mean, this maybe. And then I think, other than this, I mean, this is all very alarming, and it all looks like, okay, now we have these numbers and we have many other numbers in many other reports. But there's no political will. But I also think, I mean, times of crisis, it's also always kind of maybe the times where also many proposals and ideas come up. And the question of social protection, I mean, there are ideas, there are proposals for reform. And I think, therefore, this survey and the report, they feed into this. I mean, they're part of the analysis that has to be done in order to change it. Because as we said, even before the crisis, the system was flawed in many ways. It was not only dysfunctional, I mean, in the way that maybe the NSSF was not working the way it should work, but it was also designed in a way that excluded many people, as we said, not only foreigners, but also informal workers, etc. So in that way, it needed a reform anyway. And now at least we see the flaws, and it can be, they can be addressed. And I think, therefore, this survey and the report are very important. Just one last thing, Alexandra, because you talked about the NSSF. We have a study coming up, a qualitative study, coming up next week, hopefully, about the NSSF. So it's worth looking at our social media when we will announce it. or on the website, of course, were some of your questions. It's also like a couple of months ago that the research has been done, but some of your questions I think will be answered about trust in the NSSF and how much it lost. Okay. Okay. So that's the question of the Zahra. What is the plan after this survey and the report? To be very honest, I don't know yet what is the plan. I mean, we have a lot of similar projects going on. We will take your comments into consideration and we will see how we're going to continue with this. But I think there is definitely still a lot to be done. And maybe I would also just, I mean, Raymond raised his hand, so he wants to say something, but because we only have 5 minutes left. But maybe this is also a question to you, Nizar and Raymond, and how would you maybe like to continue something like this? Or where do you see and like what has been missing or limiting in this survey and in the analysis? So where should we go also maybe go more in depth to get more insights about this? Thank you.
Okay, I just want to raise another thing, Miriam, before answering this question. I know I have 30 seconds times 2, so I will do my best, okay? So the thing is really, really kind of important here also in the same way that what we were saying. So here we have a question, did you experience a health emergency or hard to be admitted to hospital recently? So there's like 23% that they said yes. From those who said yes here, imagine that 54% paid or covered the expenses by their own, and then 30% through private insurance, etc. Of course, the total here is more than 100% because this is a multiple response question. But you can imagine that 54% said that at least they paid something by their own. So it's really alarming as you were saying. So of course it is mentioned by Nizar in the report. And for how we can continue this study, so as we were discussing, a time series conception, or better to have a panel in order to monitor each and every period, it would be really, really very interesting. Nizar and we did already something similar for another cause. So it's really interesting to check how things are moving and how things are changing. Especially that it's really moving very fast. So you can imagine the $1 40,000. So when Nizar was writing the report now, so we are in another catastrophe. So Nizar, the floor is yours also if you want to say something.
Yeah, just to say that it's very important to have regular surveys on this topic using the same methodology. It could be something very important to monitor the changes over time. Because unfortunately, actually, another thing, this kind of survey also give us a lot of information about the labor market, about the job losses, and not only about the social protection system. And this also could fill some gaps in the social knowledge and labor market indicators or outputs, etc., etc. So this could really fill the gap if we could have this kind of regular surveys, since we know that the last labor force survey was done in 2018, published in 2019, so before the crisis. There was an update in 2022 in January, which is very, very important. But I'm not sure that CAS has the logistic and the ability to do this update on a regular basis. So maybe the social society in Lebanon is very dynamic, yet it lacks a lot of evidence and indicators. And so this survey has contributed somehow to fill these gaps.
One other thing, that since it is a representative sample also, this data or those answers can really help by answering the SDG 8 and SDG 10 for Lebanon, because we really lack a lot of data, as Nizar was saying. So also this is another idea about the SDG 8 and SDG 10.
Okay. Thank you, everybody. It's 5 p.m., so we need to stop because we have to stop in time. Thank you very much, Nizar and Raymond. It was really interesting. Like, even I read the report many times, but it was really, really interesting. Thank you very much. Thanks to everyone attending, and thanks for your questions. Just to try to look at our website and social media, we'll see what we publish and how this is going to develop. Thank you very much for the interpreter, Saria. Thanks a lot. I'm sorry if there were maybe more questions or more space to discuss. We will have maybe other webinars, other sessions, and also this webinar has been recorded and it will be published shortly. So thank you very much and have a good Friday evening.
Thank you, Miriam.
Thank you, Miriam.
Thank you, CeSSRA team.
Bye-bye.